This topic, drug and alcohol addiction, is an epidemic in this country. It's destroying lives. It's destroying lives nationwide.
Opioids are medications that relieve pain. They reduce the intensity of pain signals reaching the brain and affect those brain areas controlling emotion, which diminishes the effects of a painful stimulus. Opioids are among the most abused drugs in the United States, as they're easy to get a hold of, readily prescribed, and very addictive, a dangerous combination. These highly addictive substances are called opiates because they are derived from chemicals found in the sap of the opium poppy. They're not illegal like meth, cocaine, or marijuana, so many people can get their hands on these drugs. Because of this crisis, doctors don't know how to treat patients' pain without opioid drugs. Doctors are starting to stop giving opioid drugs to patients, leading to patients finding other ways to feed their addiction, with drugs like heroin. If you are addicted to prescription opioid painkillers, you are 40% as likely to get addicted to heroin. The effects of opioids. Short term. Feelings of euphoria, pain relief, drowsiness, sedation, lethargy, paranoia, respiratory depression, and nausea. Some long-term effects include nausea and vomiting, abdominal distension and bloating, constipation, liver damage, brain damage due to hypoxia, development of tolerance, dependence, and addiction. Someone who is physically dependent on a medication will experience withdrawal symptoms when use of the drug is abruptly reduced or stopped. These symptoms can be mild or severe depending on the drug, and can usually be managed medically or avoided by using the slow drug taper. So what is our government doing to help stop this epidemic that is sweeping the nation? There have been educational initiatives delivered in school and community centers. This is a primary prevention. In states with the most comprehensive initiatives to reduce opioid overprescribing, the results have been encouraging. Congress has held several hearings on the opioid epidemic, but no piece of substantial legislation has passed both chambers and made it to the president's desk to sign into law. While President Barack Obama's administration has allocated funding that targets this epidemic and has published new guidelines on prescribing painkillers, legislators have not come close to addressing his recent proposal of spending more than $1 billion in funding evidence-based treatment. So what can we do? In my opinion, we need to expand access to evidence-based substance abuse treatment, such as medication-assisted treatment for people already struggling with the opioid addiction. We need to expand access and use naloxone, a safe antidote to reverse opioid overdose. Naloxone is widely used by emergency medical personnel and some first responders. Beyond first responders, some communities have established overdose education and naloxone distribution programs that issue naloxone directly to opioid users and their friends or loved ones, or other potential bystanders, along with brief training in how to use these emergency kits. We need to improve detection of the trends of illegal opioid use by working with state and local public health agencies, medical examiners, coroners, and the law enforcement. But we shouldn't just rely on this. We need classes at schools and commercials showing the dangers and terrible effects that opioids have on the body. States are starting to use prescription drug monitoring programs, PDMPs. They are state-run electronic databases used to track the prescribing and dispensing of controlled prescription drugs to patients. They are designed to monitor this information for suspected abuse or diversion. Donald Trump, a Republican, wants to study legalization of illegal drugs, but not to legalize them now, says yes to medical marijuana, and that it should be decided state by state, wants to fund drug education in school, and wants to help fight the opioid problem. Democrat Hillary Clinton wants to stop imprisoning marijuana users, wants the legalization of medical marijuana, wants to fight the spread of the opioid epidemic, and is voicing support for a proposed tax that would be paid by drug manufacturers for any pain pill sold that uses active opioid ingredients. So my question to you candidates is, if you become president, what are you going to do to help stop this opioid epidemic?